Ebola is one of the deadliest diseases in the world, and now health workers say it is spreading. West Africa is facing a serious crisis, the largest ever outbreak of Ebola. Christian International Relief Organization Samaritan's Purse is among several non-government organizations that have responded to the crisis. Its medical team director, Dr. Lance Plyler, talked to us via Skype from Monrovia, Liberia, and described the outbreak as monumental.
It's really unprecedented. Right now, it's not just a problem within a given country. It's a real sub-regional problem in terms of geographical distribution and in terms of patients infected.
50 new cases of Ebola were reported within the last week in Sierra Leone and Liberia. Guinea is also a country of concern. However, no new cases have been reported there as of early July. Overall, 844 cases of Ebola have been reported in the three countries, and 518 people have died from the disease. There is no known cure for the virus, but in the past, health workers have successfully prevented the disease from spreading. Plyler suggested the disease isn't always recognized because some of the symptoms mask diseases endemic to West Africa, such as malaria or typhoid.
Initially, the person presents with fever, and then malaise. Their muscles and their joints begin to ache very intensely. It's followed by nausea, vomiting, diarrhea, and then in the very advanced cases, there can be bleeding.
So how is the disease spreading?
The people in this region, they eat what we call bush meat, which can involve eating bat, and that's what occurs with the primary transmission is that a person will eat some meat, perhaps bush meat, perhaps a bat. It's very, very infectious through body fluids. Unfortunately, just through the transmission of body sweat. It's very cultural here with the burial ceremony that the loved ones prepare the body, and there's a lot of washing of the body and preparation for burial. And that is a very, very common mode of transmission.
He said Ebola is unlikely to spread to America, but more doctors and nurse volunteers are needed to help the effort. CBN's Operation Blessing was also among the first to respond to the Ebola outbreak. Last May, OB sent medical supplies, including gloves, face masks, and coveralls with hoods, to the Liberian government. The items were used by aid workers treating Ebola patients on the Sierra Leone border. Gary Lane, CBN News.